Good morning and good afternoon, everyone. We're so glad that you joined us today for our session on policymaking for housing justice, unpacking the equity challenges of housing code enforcement. My name is Shaniqua Owusu, and I am the Chief Strategy Officer at ChangeLab Solutions. Before I hand it over to my colleague, Greg, to kick off this great discussion, I wanted to take a moment to welcome you all, as well as briefly introduce you to ChangeLab Solutions. We are a nonpartisan, nonprofit organization that uses the tools of law and policy to advance health equity. We partner with communities across the nation to improve health and opportunity by changing harmful laws, policies, and systems. Our interdisciplinary team works with community organizations, government, and local institutions to design and implement equitable and practical policy solutions to complex health challenges. Our work is rooted in the belief that laws and policies that have perpetuated racism, discrimination, and segregation throughout our nation's history have had and continue to have a profound effect on health and well-being. As such, we are focused on addressing what we call the fundamental drivers of health inequity. Those are structural discrimination and racism, income inequality, disparities in opportunity, disparities in political power, and governance that limits meaningful participation. We outline this framework in our Blueprint for Changemakers, which is available on our website for anyone interested in diving deeper. Today's session is the first in our 4-part Equity in Action series. Throughout this series, we'll explore strategies to address these drivers by focusing on a specific issue area and hearing from folks representing diverse sectors. We're kicking off this series with a conversation about housing justice, and that we hope that you'll join us for the upcoming sessions. We've got a great lineup for you, and we'll be discussing labor, fair labor practices, equitable policymaking in rural communities, and the important role that public health authority and the public health workforce plays in supporting equitable health outcomes. With that, I want to thank you all for being here, and I'll pass it over to my colleague, Greg Miao, to get us started on the conversation. Greg.
Great. Thanks, Shaniqua. First, I just want to take a moment to go over some logistical notes for today. So first, we are recording this event, and it will be posted on the ChangeLab Solutions website. You'll receive an email with a link to the recording once it's ready. If you have any questions for our panelists throughout today's discussion, please submit them through the question and answer box. My colleague, Melissa Marichal-Zayas, will be monitoring incoming questions, and we'll have some time at the end of the session to try to address them. The chat function for this webinar is also open, so we invite you to share comments or reactions along the way and engage with fellow attendees. And finally, we'll be live tweeting during the session, and we invite you to join us on social media using the hashtag policymaking for equity. You can go on to the next slide. I also want to just let everyone know that there's a live transcription option available for today's session. So in your Zoom window, you should see a button that says live transcript pictured here on the slide. If you click on that, you'll have the option to either show or hide subtitles. You can also adjust the font size to fit your preferences under the subtitle settings. Our colleague, Bernard Lim, is helping us ensure all the tech runs smoothly today. So if you have any technical issues, please reach out to him directly via Zoom. All right. Go to the next slide. Thanks. So welcome again to the first episode of the Equity in Action series. Today's session is Policymaking for Housing Justice, Unpacking the Equity Challenges of Housing Code Enforcement. My name is Greg Miao. I'm a senior attorney here at ChangeLab, and I'll be facilitating the discussion today. And I just have a few slides that I want to run through to set the context for our conversation. So there are a number of ways people have conceptualized the connection between housing and health, but this is one that I like that comes from a lit review that was done by Lauren Taylor back in 2018. She classified the evidence on housing and health into 4 pathways, sort of by which the former affects the latter. First, there are health impacts resulting from housing instability, which is often associated with poor physical and mental health, particularly for children and adolescents. Second, conditions inside the home, such as exposures to mold, pests, and chemical toxins is directly harmful to human health. Third, lack of affordable housing is detrimental to the mental health of people living in low to moderate income households, and the financial trade-offs accompanying being rent burdened can lead to the postponement of necessary health care. And fourth, neighborhoods, including both environmental and social characteristics of where people live, can impact health, whether in a positive manner through access to jobs, transportation, and green space, or negatively through increased exposures to things like pollution and crime. But if we go to our next slide, there's another conceptualization of the connections that I also like to uplift. And this one comes from our partners over at the Human Impact Partners. And while it's slightly different in that it doesn't include the neighborhood pathway, what I like about this slide is that it shows that the pathways by which housing and health are connected are not independent, but rather really do influence each other as well, along with other external forces. So lack of affordable housing not only forces families to make difficult choices between paying for rent or other basic needs, but it can also force families into living in unhealthy and unsafe housing conditions. Poor housing can lead to direct health challenges, forcing families to either move into new or worsening new housing, or it can worsen household cost burden, making already unaffordable housing even more unaffordable. And housing instability can make it harder for families to find and access affordable housing through things like impacts on credit scores or the way that landlords will do eviction checks. Or it can force families to accept living in unhealthy and dangerous housing conditions due to sort of the lack of power that they hold within those situations. So with that context, we're here to talk a little bit about one of the policies that can play a key role in supporting community health and interrupt the way in which families cycle through housing, affordability, quality, and instability challenges. Housing code enforcement is the process of inspecting housing units and bringing enforcement actions against landlords to ensure that landlords maintain their properties in compliance with local housing codes. These codes establish minimum standards intended to protect residents' health, such as necessary heating, plumbing, and hot water requirements, abatement of health hazards like rodents and insect infestations, as well as things like kitchen and bathroom standards to ensure that those units allow for all the things that people need to do in a house. So housing and building code enforcement not only helps ensure the habitability of specific properties, but it also helps keep surrounding homes safe. With that, though, housing code can face some challenges, and that's really what we're here to explore today. So that'll be on the next slide. It really means that this is as a policy tool requires thoughtful use and planning, in order to be a tool that improves health equity. So there are a number of structural challenges that exist within this area. And to effectively do the work that we need to do, housing code needs to sort of acknowledge the role that it played in deepening segregation and taking land back from Black communities. It needs to be done in a manner that addresses the power dynamics and enforcement challenges that can allow landlords to put off remediation or retaliate against tenants. It has to grapple with and negotiate circumstances where enforcement can lead to negative consequences for existing tenants. And it needs to be utilized in a manner that ensures that it's not weaponized or utilized to exacerbate existing inequalities, create undue burdens for marginalized communities, or in a manner that fails to account for the larger housing affordability and stability challenges families might be navigating. So with that, we can move on to the panel discussion to start unpacking the equity challenges of housing code enforcement, with the goal of identifying some strategies that local government can use to center tenant health and move towards a more equitable enforcement practices. And I'm thrilled today to introduce the panel we have that'll be engaging in this conversation. First up, we have Liz Tobin-Tyler, Associate Professor of Health Services and Policy and Practice at Brown University School of Public Health. She teaches in the areas of policy, health justice, public health law, and biomedical and public health ethics. Her research and writing focus on the structural and legal determinants of health and health inequity, public health law and policy, reproductive justice and maternal and child health disparities, poverty and social safety nets, and interprofessional health justice education. Next up, we have Larry Brooks, Director of the Alameda County Healthy Homes Department and Child Lead Poisoning Prevention Program. Larry has worked in government in California for over 30 years in various capacities in code enforcement, and is a member of the National Center for Healthy Housing Policy Steering Committee and California Healthy Housing Coalition Steering Committee, as well as a member of the National Forum of Black Public Administrators. Larry's also been recently recognized by the EPA and President's Task Force on Environmental Health Risks and Safety Risks to Children for setting a new national standard in providing training to code enforcement officers in the regulation of lead-safe work practices pertaining to the EPA Repair, Renovation, and Painting Rule, otherwise known as the RRP rule. And finally, we'll be joined by Kathy Zeisel, Director of Special Legal Programs at Children's Law Center, where she works to expand the center's impact through identifying and supporting opportunities across legal programs. Kathy has been a leader in the Children's Law Center's healthy housing work, working to make sure all DC residents have access to safe and healthy housing. She was previously a senior supervising attorney with Healthy Together, a medical legal partnership, which brings Children's Law Center's lawyers side by side with pediatricians and health clinics to find and fix the root causes of a child's health problem. So we could switch over and drop those slides, and I'm be super excited to have all of the speakers here with us today. So we started this conversation off talking a little bit about the systemic and structural challenges that housing code enforcement faces. And really a change that we believe that systemic and structural challenges require systemic and structural solutions. So with that in mind, I was wondering if we could start off with you, Liz, and if you could this is an all-person question, but if you could start sharing a little bit about what your journey to working on housing quality and housing code enforcement was. And what was it that you were sort of discovering or uncovering in that work that led you to identify ways that it wasn't working the way it was supposed to or the way it best could? And what are some of the structural challenges that the communities were facing that as a result of that?
Yeah, thank you, Greg, and thank you for having me today. I'm really excited about this discussion. So my work really started with 25 years ago with work focused on medical legal partnerships, so the intersection of health and law, and trying to understand how law functions to either protect or harm health. With regard to housing in particular, I contracted with some community organizations in the early 2000s to look at the problem of lead poisoning in Providence. At that time, about 1 in 5 children were lead poisoned before they entered kindergarten. So it was a huge problem. And what a lot of people were seeing is that despite some protective laws, those laws were not being enforced, and children often sort of served as the detectors of lead, paint hazards, and other kinds of housing code violations in terms of their health. And so I did a study actually looking at the enforcement gaps with regard to the ways in which the municipal housing code agencies did or did not work with the state, particularly around identifying lead hazards. We actually had a new law that had been passed that was increasingly or more protective with regard to tenants' rights around lead hazards. But what we saw is that there was little enforcement even after the law was passed. It really gave me an on-the-ground lesson in the difference between law on the books and law on the streets, and sort of the need to really focus in on accountability and enforceability of existing laws. I also saw firsthand from that work the tremendous disparities that existed across not only the problem of lead poisoning and other kinds of health-related housing issues, but the lack of enforcement in particular communities where particularly children, but others were being harmed. I went on to chair the Rhode Island Alliance for Healthy Homes, which was intended to really bring as many stakeholders together as possible to think more comprehensively about safe housing in Providence and in Rhode Island. And I can talk more later when we talk more about where we are today about how successful some of those efforts have been. But it's a long-term project of mine to be engaged in those conversations.
Thanks. I really appreciate that, Liz. I think maybe we can switch over to Kathy now, because Liz mentioned sort of starting with that MLP model, and I think that's something that you all have really done a lot of work with. And so, how did you all come to start working at the Children's Law Center on healthy housing issues?
Sure, Greg. Thanks for asking. Well, in our medical legal partnership model, we have attorneys at primary care health centers for children around the city with several medical partners, and they are embedded in those health centers and getting our referrals from the medical providers and staff on site. And so we really approach it with that health lens. And what we found is that we were getting a lot of referrals, particularly for kids with asthma, where the doctors were saying, hey, we can medicate these kids, but their asthma is still being exacerbated. They're still ending up in the emergency room or hospitalized because of the housing conditions. And there's nothing that we can do to medicate. We don't want to increase the medications any further. We need to get the mice under control, the cockroaches under control, the mold under control. And from the clinic that I was in, I often saw, these vans rolling by that said, well, paint over your mold and fix it. And that actually would let them pass the kind of housing code inspection we had that time in DC, but not obviously solve the underlying issue. And as we got further enmeshed into sort of housing code work and housing conditions cases, we found that getting the housing conditions fixed had a significant impact on children's health. And we actually, our evaluation and data team did some really important research around that. And we found that we had two things we really needed to work on upstream. One was making some important changes to the actual housing code and surrounding laws to strengthen the law. And as Liz talked about, really making sure that enforcement happened once we had a really good baseline of what the law said, to make sure that both complaints were addressed, and also we were thinking about how to build a system that can proactively prevent buildings from becoming major problems and stop kids from getting sick and not wait until kids are the canary in the coal mine of buildings. So that's sort of how we approach the work now, is both through individual cases and trying to build a better system that works in DC.
Thanks, Kathy. And Larry, you've been doing this for a while, but I think you also have a really interesting sort of story in terms of how you came to start working on this and where it's really led you. So could you just share a little bit about that?
Sure. In terms of my journey, and Greg, you kind of touched upon it in terms of understanding that I'm a tool, and who uses that tool determines the outcomes of people's health. As a code enforcement officer, I often found myself early in my career working in situations where I had to drop everything to respond to an elected official's priority, in part because our units were typically understaffed and could not have one person assigned to just put out every elected official's brush fire or quiet one of their constituents' squeaky wheels. While addressing those issues, I saw the inequities and how I was being instructed to sometimes finesse a situation depending upon who the property owner was, versus put down the hammer on others, particularly in those neighborhoods that you mentioned at the introduction. Additionally, I, as well as other code enforcement officers of color, were experiencing racism within the system ourselves. I experienced having the police called on me while I was trying to do an inspection. And I wasn't the only one that had the police called on us while we were in neighborhoods, in uniforms, in cars, and still having the police called on us. I got actually spoken to several times about my doing my job in such a way that created maybe a hardship on the management or on an elected official. Basically, I was told on occasions to stand down simply because of the person that I was doing the enforcement action against. And it never seemed to be a person of color that I was being told to stand down for. I also experienced budget cuts and staff layoffs during recessions when the need to maintain habitable housing was at its peak. And during economic boom years, when rents were skyrocketing, I observed elected officials resisting restoring code enforcement staff or supporting innovations in code enforcement. Innovations, something as simple as going from using a clipboard to a field laptop computer. There was that kind of resistance to help code enforcement get the job done. And at that point, I decided that we needed to take action ourselves. And I joined the California Association of Code Enforcement Officers, and we began to push legislation and get laws put on the books that would basically force the elected bodies to do what we knew was necessary in order to really adequately and equitably enforce housing codes.
Yeah, thanks, Larry. And I was hoping maybe we could build on that a little bit and you start talking about where that led you to, what that led you to sort of advocate for, and what was the scope of that legislation. And I know Kathy, you worked on some advocacy efforts as well. And what were the policy solutions that you identified to the structural challenges that you were facing? And I think you're speaking towards sort of, or you'll both speak towards different things. And I just want to both uplift what you're doing, Larry, from a sort of inside out policy making position, and then we'll transition over to Kathy and what they've been working on in DC.
Okay, because I want to touch upon what Kathy talked about in terms of asthma. The California Association of Code Enforcement Officers, in partnership with the California Healthy Housing Coalition, pushed a bill, Senate Bill 655 in 2016, that gave code enforcement officers the authority to respond to mold complaints and take action. And up until that time, we were telling our elected officials that, we needed the authority to respond to mold, but we weren't getting anywhere. More recently, we were able to partner with some coalitions. I like what Liz talked about as far as community coalition building. We were able to partner with some community groups in order to get Senate Bill 1076 signed into law just last year, because we were getting a lot of complaints about painters and contractors creating lead hazards, but we did not have the enforcement authority or the training, in fact, to do responses to those types of complaints. And under that new bill, we will now get the training we need. You mentioned the renovation, repair, painting rule. That training, now all contractors in California who do lead paint disturbing work will have to take that course, but code enforcement officers will also get to take that course in order to do a better job of enforcement. And last but not least, most recently, Assembly Bill 838 was passed, which requires all cities and counties to have a tenant complaint response program, because many cities and counties in California did not have a tenant complaint response program in place. Code enforcement officers were trying to get those elected bodies to do it, but in terms of funding priorities, as I say, oftentimes police and fire, they're the sacred cows. Code enforcement is the sacrificial lamb. They didn't want to fund it. Now, under this new law, they will have to fund it. So those are just a few examples of how we've kind of flipped the script in terms of, yeah, we want to be that tool, but we want to have the authority. We want to have the funding we need to do it fairly and do it effectively.
And Greg, in DC, we have, as I mentioned, kind of pursued two tracks, some similar to what Larry was talking about. In terms of the health impacts, we see that you're 27 times more likely to end up in the emergency room or hospital for asthma if you're a kid, if you live in in the areas of DC where kids are lower income and it's an almost entirely Black population of DC than you are if you live in the wealthier areas of DC, where we have a much larger white population in DC. And we see both racial and income disparities among the health impacts of housing conditions in DC. And unsurprisingly, we also see bigger issues with housing conditions in those areas. As we began to approach this upstream, we really wanted to keep that kind of equity lens on it. And that's how we've talked about it. And our council actually has an equity office that puts out a statement with each of the legislation. So that's a lens that they're trying to approach the work also. We approach this with some legislation pieces. We have a mold bill that specifically requires professional inspection and remediation of mold. We are trying to modernize our lead laws. And then we also ended up trying first to collaborate to improve the agency that does housing code inspections. And when that didn't work, we worked with our council to actually break up the agency. And last October, a new agency was formed that just separated the housing inspections out of the other agency that previously held it, with the hope that, and then it also changed some of the functions, created a strategic enforcement division, required a public health official to be put inside of that agency to have a public health lens on some of the inspections, in the hopes that we would be able to change how we do housing code enforcement. And we also have a proactive inspections bill pending right now, so that we're not, as I mentioned before, just doing complaint-based inspections, which we already know there's a problem then, to really try to have a tiered inspection system where we are using a data-driven approach to try to figure out where there are problems before the buildings really deteriorate, and we can really figure out where the problems are and get to them. We know that we're not going to be able to inspect every rental property in DC every year. And so we really want to figure out how to get to the ones that are most likely to lead to unhealthy and unsafe housing, so that we can protect tenants and not rely on just complaints. When we look at the complaint system, we see that residents who might be newer to DC, residents who maybe don't know that our complaint-based system hasn't always had our complaints. Some of the problems we saw is there's very rarely enforcement with it. One of the last years we saw data for enforcement collections. We saw that the agency collected $70,000 of $10 million in fines issued. So landlords often figure that there's no point in following the citations because they're not likely to get anything happening to them. And so we see disproportionately fewer complaints in the areas we know there's housing conditions, because those residents may not have a lot of faith in the city agency. And if that's what we use to drive proactive inspections, then we're not going to have proactive inspections in the right areas of the city. So we're trying to use the legislation to use public health and other factors to make sure we're looking at the right areas of the city. I'm talking too long, but this is an area that we've become really interested in, and we're trying to really build a system that works and brings in these equity considerations.
Yeah, I really appreciate that, Kathy. And I was actually going to just turn to Liz a little bit and see how that resonates with your experience and what you were finding in the Providence area in terms of sort of the utilizers, who's able to utilize, the code enforcement and the system as it existed versus sort of what their experiences might have been with the other aspects of the carceral system, or how they felt able to sort of engage with government in this manner.
Yeah, I mean, I would certainly agree with both what Larry and Kathy have said about, the challenges of equity in the enforcement system, and both from Larry's perspective about sort of politically whose needs are met first, and the ways in which the enforcement system often gets structured around the priorities that are either directly or implicitly conveyed to code inspectors. But I also want to pick up on, I think, some of the really good points that they've made, and then I'll talk a little bit about what I see as a connection with the criminal justice system. First, I want to just reiterate what Kathy said about using data, because I think, from my perspective, there's all of this information that could be used to target very directly proactive approaches to enforcement, which takes some of that sort of bias or discretion out of the picture, and really, think productively about where are the neighborhoods, where are the houses that we know have hazards that should be addressed. And that should really be driving priorities. The problem with the complaint system, as has been said, is that particularly for low-income tenants, either they don't feel that the system is responsive and so don't really trust it. But we've also seen here a lot of retaliatory action that is not checked. by the court, even though we have a retaliatory eviction law that's supposed to protect tenants from being evicted if they call code enforcement or call the authorities. But unfortunately, because of the lack of legal representation, the lack of knowledge about their own rights, many tenants don't know that. They're extremely reluctant to call what they consider to be calling authorities on their landlord, even though it's to protect and exercise their own rights. One of the things that I have been struck by, and this actually came from driving down a highway one time and seeing a sign about speeding, and it said strict enforcement for speeding laws, and it was one of those large flashing lights as I was driving somewhere. And it made me think about what we mean when we say strict enforcement and what laws we're talking about when we say that. And the thing that resonated with me is that, a person in a low income neighborhood might be arrested for selling individual cigarettes, which maybe ostensibly has a public health benefit. I'm not sure what the purpose of that type of law is, but they can't get a response to exercise their rights to have safe housing. So we have a system where we are prioritizing and providing resources to arrest people for minor criminal offenses, which, as we all know, have long-term implications for people's health and well-being. But we're not prioritizing our resources to enforce laws that are protecting their health and safety. And if you think about someone like Freddie Gray in Baltimore, who was lead poisoned, he was not protected by the law in the sense of protecting him from health hazards in his own home, but then had, long-term interactions with the criminal justice system. So I think it's important when we think about this to think about what we prioritize, the resources that we devote to enforcement at different levels, but in particular in this case around housing. And I'll just add one more thing because I'm talking too long, that Kathy mentioned, which I think is, when we think about enforcement, we need data to help us drive that enforcement. We need culture change within institutions, as Larry talked about, in terms of prioritizing how we do it. But we also do need to be sending the signal to the community that particularly property owners who need to understand that there are ramifications for not following the law. And I think having in Rhode Island, the Attorney General has recently brought some high-profile cases to demonstrate that. And I think that's another critical aspect of the messaging about the importance and the prioritization of housing safety.
Yeah, thank you all. This is such a great conversation. It's just reminding me and uplifting sort of that sometimes there can be, we pass these laws and the intent is to improve public health, but somehow it gets distracted away from that. And, there becomes an over focus on, bringing punitive actions or over focus on bringing enforcement actions and losing sight of like the core tenet of what housing quality laws are, which is to protect resident health. And how important it is for us to maintain sort of guiding principles in the application or pursuit of our endeavors here. It's something that we've written a little bit about in our sort of equitable enforcement work as well. That oftentimes you need to sort of build in some processes by which you can recenter or re-audit yourself to make sure that you're checking that everything you're doing is in furtherance of that one goal of improving community health. So with that, though, I want to move our conversation on to the next stage, which is about about the implementation of these sort of policy changes or that can help support improving community health. And someone mentioned it already, and I'm sorry, I forget who, that just passing the law itself is very different than actually implementing it and enforcing it in a way that is achieving its ultimate goals. And so we're gonna go back to all of you in just a sec, but maybe we can start with you, Larry, to talk a little bit about what that means from the inside for someone who's working in the system. There are obviously, you've mentioned a couple of those additional authorities or powers that you've been working towards finding. What else needs to happen for you all to be able to successfully implement, something like a proactive rental inspection program, or even the responsive code enforcement programs?
Really takes community support. I'm here in Oakland, California, where the Alameda County Healthy Homes Department would not even exist if not for a community activist group known as People United for a Better Life in Oakland. And I think they got their motivation from the Oakland Black Panthers, who started the first health fairs where they tested for children for lead poisoning. Advocacy has been a key factor in the work that we've been doing here in the county. And it's real easy to know why, in terms of code enforcement officers, as I said, are basically the tools of government, and elected officials don't necessarily listen to code enforcement officers, but they do listen to their constituents. And so in terms of our attempts to get a proactive rental inspection program going, it has been very difficult because historically, rental housing associations, apartment owners associations, residential property management associations, they typically know how to work the system, how to throw their weight around with the elected officials. And oftentimes the tenants are the weak ones that don't know how to work the system. And until they band together and form, tenant rights organizations and coalitions in order to combat that type of influence, we can't get anywhere with a proactive rental inspection program in many of the cities and here in the unincorporated county, in fact, where we've been trying to get them to go in that direction, knowing that proactive rental inspection program takes a lot of burden off of the tenants. I've been meeting with rental housing associations just the last couple of weeks, where people keep telling me, oh, tenants will complain if they really have a problem. And we all know that's ridiculous. A proactive inspection program takes that weight off of the tenant so that the landlord doesn't have to retaliate and say, you outed me, you blew the whistle on me. And so that's one of the benefits. But in terms of proactive rental inspection programs, and I see it in some of the Q&A questions here, you have to combine it with tenant protections. Because we know that there are some landlords who will still try to retaliate. We know that there are some landlords who are going to resist relocating tenants when we find uninhabitable conditions present. So you have to have this two-pronged approach to moving forward. And again, you can't get it from the code enforcement officers. Just 2 hours ago, I was talking with a planning director who said, well, if all of the code enforcement officers in every city in Alameda County got together, you'd be able to get this done. And again, that's laughable. They're not going to listen to us. We work for them, but we also work for the community. If the community tells them this is what we want, then we have a chance of getting it. But otherwise, code enforcement has to do this backdoor approach in terms of trying to get legislation passed so that at least we can go to our bosses and say, you better do this because it's a law and you might get sued if you don't do it.
Yeah, so I'm going to turn us over to Kathy here, because I think that you really helped uplift the role of community accountability and community buy-in. And Kathy, I just want to turn it to you because I think your organization's had to fill that role a little bit. And so I was wondering what your thoughts are on sort of what needs to exist sort of outside of government to make sure that, the programs are being implemented in the right way.
I think even where there's community buy-in, you need like constant watchfulness, right? Because you need to be able to constantly report what's really happening on the ground versus what's being reported that might be happening, especially if I think in DC, there's individual inspectors who are very much want to make sure people live in safe and healthy housing, but that might not be the willpower of the upper part of an agency, right? And so that's not what the policymakers are hearing aren't from the individuals on the ground. They're hearing it from the reports that come up to them. And so our role is often to report what we see on the ground, to help residents report what they see on the ground so their voices are heard. I also just wanted to add some of the details that are also needed in addition to this voice on the ground, because we found as we've navigated this, we actually also big obstacles have been, our inspections program, our city doesn't even know what the apartment complexes are to inspect them. They inspect by tax lot. So we can't even say if we're inspecting this whole giant complex that's 10 blocks long, what all the problems are there, because they can't actually enter that in their computer the way they have it. And now we need just those technical things. We don't even know what landlords own properties because we register them by LLCs. We finally got a law passed that requires people to disclose who the real owners are, but we don't have enforcement of that law that's effective. So again, there's lots of little pieces that you need to build up if we really want effective proactive inspections. And I saw a lot of questions coming up about like, what kind of data do we need? And those are all the pieces we're trying to force in as community voice right now too, of, hey, these executive agencies don't share any data. Please make them have memorandums of understanding so that public health data has to feed into the inspections data. So our agency that gets lead data, which is environment and energy, feeds into inspections data, so that there's an asthma registry that our DC Health funds, Department of Health funds, that should feed into this. So there's lots of data that there's pretty good evidence base, has a basis in housing conditions and links to it. And we need somebody to have that global view and then figure out how to get it and put it properly into an algorithm. I said the word algorithm, you got as far as I know about it, but we need that. We need to make sure that it's not creating a biased algorithm, which we know is a big concern right now. But how do we make sure we're really picking the properties using the right data and not just what feels like randomly selecting them or using just bad data in, bad data out, which is what's sort of been happening so far.
Yeah, I do want to follow up with you really quickly because after you finish taking a drink, because we talked a little bit earlier about the partnerships and institutions that you partner with to sort of bring this external accountability focus to city council. So I was wondering if you could tell us a little bit about your work with Children's National Hospital and specifically the effort that you did in terms of the asthma mapping there.
Yeah. So one big data piece, because we try to be data driven with some of our internal work also, is we've done some mapping internally of just where our housing conditions cases with some prior funding, but Children's National got funding from Fannie Mae to work with us. They have an asthma registry where they know where the vast majority, like 15,000 of the 16,000 kids in DC that have asthma are. And they were funded by DC Health to develop that. And then we worked to get the housing conditions data, both from our cases, and then we scraped the city data, which isn't publicly downloadable, but is available to be scraped, and had it categorized by asthma hazard conditions. So not weighting all of the conditions equally, but looking at which ones were related to asthma hazards, and mapped it all basically. And then we worked with the Urban Institute to get some of the complexes, the apartment buildings mapped where they had shape files, especially for subsidized housing. And we were able to layer all that together and identify properties which had a high asthma morbidity, so the highest rates of kids going to the hospital for asthma, and the highest rates of problem asthma conditions. And when layering those two together, that's helping us drive forward some other systemic work around rehabilitation, or the carrot and the stick, the rehabilitation for litigation, working with the Attorney General's office, who in DC also has an amazing social justice team, bringing some of those cases as well around enforcement. So thinking about how to use that map as the next step. But we've been really happy to do that work. It's been really exciting, but to be honest, the government should be doing that work. And a lot of what we do is really great, but we'd be happy to put ourselves out of a job if we could get a functioning system out there and have tenants be able to rely on government agencies doing this type of work.
Thanks. So Liz, I'm wondering if you have any reaction to the discussion that we've been having. And in particular, we've got this question or this challenge because we have the word enforcement, right? And code enforcement, should be and hopefully is utilized in a way that is health equity promoting, but it can have harms, whether it's for landlords or for the tenants. And so I'm curious what your thoughts are in terms of how do we nuance or how do we approach this concept of bringing equity to the enforcement process, as well as sort of maybe some of the structures that Larry or Kathy were talking about in terms of having these external supports or external secondary policies that you can help buttress maybe some of those negative consequences of an enforcement action.
Yeah, I want to sort of pick up on things that both Larry and Kathy said, I think, Larry started out talking about the importance of community organizations, of tenants organizations. Here in Rhode Island, we have an incredible organization, the Childhood-Led Action Project, which was formed basically to organize parents of lead-poisoned children. And they work in collaboration with a number of other housing-related organizations. And I think, as Larry said, the voices, the pressure from the community, from people from the community themselves, it can be very powerful. It takes a lot of organizing to make that happen. But I think that's crucial, not just because maybe politicians are more likely to listen to constituents, but also because they know how the systems work, unlike many other people, because they see it every day in terms of the lack of responsiveness. So I think that community engagement piece is crucial. Kathy's work and the Children's Law Center work using data, I think, is so powerful, and we've seen that with other medical legal partnerships. I think that's one of the powers of partnership, is to have clinicians who can identify health outcomes and then work with their legal partners, with their public health partners, to put all of those pieces together. And as Kathy said, we should be doing that. The government should be doing that, but often that's not the case. And I think, things like GIS mapping and other ways of really being able to use that data can be very powerful. And we've seen in Cincinnati Children's, for example, they did an amazing study of that, where they were working with looking at lead-poisoned children who were being hospitalized, as well as children with asthma, and working with their legal partners to bring litigation that was very successful. So I think, from the external side, that all of those things are really critical. And then, I think to your question about sort of the ramifications of enforcement can go either way. I think it's really important when we think about enforcement actions to understand the property owner situation. Some property owners, as Kathy mentioned, live out of state. They have no connection to the property. They're not managing it. They may be, have multiple properties that have code violations. That's one kind of situation. We also have a number of very small property owners in Rhode Island who, have one or two houses, who don't have the money to actually do what they need to do. And we need to be better about sort of identifying the resources for them to help them make the home lead safe, to address housing code violations. And, there is money out there. And I think, again, it's a targeting issue. It's figuring out, systems, putting systems in place so that enforcement actions are responsive to the need, both of the tenants and of the property owners. So I think, that speaks to, again, having the right information, the right incentives in place for enforcement, and then being able to try to really think about distributing resources appropriately to reach our goal, which is to have safer and healthier housing.
Thanks. So we've talked a little bit then about some of the ways that the power dynamics within the housing situation are structural drivers of some of the challenges that people are facing, whether it's ability to access government or file a complaint or make repairs. And so it's a very open-ended question, but how do we shift or the power dynamics that we have to address those structural changes? What are if you had to pick one or two things that you would recommend or you would hope that we could do or to address those power dynamics, what would those be? Maybe I'll go to you, Larry, first.
I would look towards places like Rochester, New York, Cleveland, Pittsburgh, Milwaukee. Those are all cities that I look at when I'm trying to find out who's getting the work done and who's doing it most effectively. And those cities have formed public-private partnerships in which they've been able to raise millions of dollars to not just fund a proactive inspection program, but to provide money to the small mom and pop landlords, even some rich landlords, as long as they're renting to low income families, kind of the HUD-led hazard control grant model approach. that's where I look in terms of, what does the future look like? I hope it'll look like some of those places that have formed those types of public-private partnerships. Also, I look towards, we need more equity within the system. People have been saying government needs to do this, government needs to do that. The reality is government is very reactionary. We probably wouldn't even be having this conversation if not for things like the death of George Floyd or the Flint, Michigan crisis. Government only responds, or typically responds, when there is, some type of disaster. Oakland here would be the ghost ship fire. We need to get more community involvement so it doesn't get to that. We need to get ahead of the curve here. And one of the other ways we get ahead of the curve is in terms of equity. We need to have more code enforcement officers of color. We need to have more women code enforcement officers. That's going to be one of my discussions at the Women's Leaders and Code Enforcement Symposium that's coming up. I'm so excited that as a guy, I get to go and speak at that symposium. But that was started by Cici Muela, a woman code enforcement manager who felt that there was a need to form an organization that would help recruit and groom women for leadership in code enforcement. We need diversity if we're going to attack the equity situation.
Oh, great. That's a really powerful point. I think you're right that the representation is so important. It reminds me of sort of what one model that I really love that comes out of Cleveland, in terms of the work that they did in their lead poisoning prevention with Environmental Health Watch, which is a nonprofit organization that hired and trained members of the community that the communities that were affected by high lead poisoning rates to train them to be lead poisoning inspectors, so that they had sort of a job training component, but were also representative of the community and could sort of build access and build buy-in from the communities in terms of the need to really address that challenge there. And so I think that that's really been a pretty foundational thing. Kathy, how about you? What are your thoughts in terms of things that we need to do to change the power dynamics here?
I think everything Larry said is great. I think I'd also add, we really need to find a way to be proactive with this. We need to not wait for people to be a canary in the coal mine. Like Larry said, people are reactive in DC. It was a fire that unfortunately killed a child that led people to spur on to really think about how to change, to really move things forward. And I liken it to our parking ticket system enforcement in DC. If you've been in DC, you will get ticketed and towed in 5 minutes flat if you park in a no parking zone. We need people to understand that we're not always going to find out if you have housing code enforcement issues, but we might. And when we do, it will happen, unlike the system we have now. And we need to put a health lens on things. Right now, I think us, like many other places, it's a violation, so it's a violation. And our lead laws are a little separate, and our mold laws are separate, and by separate inspection teams, and there's separate funding. If we want this to work, we need to understand that the reason we care about housing code enforcement is not just because it's a law. We care about it because it affects people's health and safety, and disproportionately that impacts in DC, our low income Black and Latino residents in DC. And if we're going to do anything about it, we need to put that equity lens on it and help people care about it. And that will bring the community into it instead of approaching it like we do now, which is just this bland, people need to inspect it, so that people aren't contracting out of, in their leases, I don't have hot water in my lease, so I guess it's fine I don't have hot water. Really educating people about their rights and that it is a health issue. So I say that over because really seeing it as a health issue for me was sort of life-changing in how I approached inspections. And I think it is a way to really bring in not just residents, but other players into the work. In DC, we formed a Healthy Housing Collaborative, similar, I think, to what Liz has talked about, that's really brought a cross-section of players into this space. And I think it's really helped us move the needle.
Liz, thoughts?
Yeah, I mean, I love what Larry and Kathy talked about. I think, and I'll reiterate Kathy's point about tenants' rights. I mean, I think strengthening, laws around tenants' rights are critical, because so much of this has to do with the power imbalance between property owners and tenants. For example, I know here in Rhode Island, most low-income tenants don't have a lease, so they have very, very few protections for housing stability. And I think that's the other connection I would make, is that, as Kathy said, in helping people to understand the health consequences of unsafe and substandard housing, but also the connection, and you started with Lauren Taylor's work, between housing instability, eviction, unaffordable housing, and housing safety. Because what we know is that when there's not enough affordable housing, or people are unstable in their housing, they're going to end up accepting conditions that they should absolutely not have to accept. And so, I think helping tenants to understand their rights, but also building broader coalitions around housing in general. And I think that's actually happening really nicely in Rhode Island with an organization called Homes RI, which is really focusing on the affordability, safety issues together, because, this is a problem everywhere, affordable housing, but we see particularly in a lot of urban settings that people are ending up, just having to live where they have to live because they have no other choices. And so I think it's empowering people, but also sort of tying these things together in a way that's a narrative that can help explain the ramifications of not prioritizing both affordable housing and addressing poor conditions.
Great, thanks. So I think we're going to start to incorporate some of the questions that we've been receiving through the Q&A. And I really appreciate all of this really robust chat that's happening and all the questions that you've all been submitting. So apologies in advance for not being able to get to all of them, but there are some really great ones here. And so the first one I wanted to turn to for you all, and this is, I'll let Larry, maybe you can go first on this, but I'd be curious for what other folks' thoughts are. Is what do you do when where we're going on these inspections, and we're going to go really narrow on like a specific equitable enforcement challenge, which is we find tenant side violations, right? We know that in our housing code, and the law will split out what are tenants' responsibilities and what are landlords' responsibilities. What are the approaches that you try to utilize, Larry, in your work, or what do you recommend for code enforcement officers that are finding what might be, it's not necessarily on the checklist of what the code enforcement officer is there for, but might be finding tenant side violations?
Yeah, it's one of those things where Healthy Homes Department, we consider ourselves an educational institution. And so much of what we do falls under the category of cooperative compliance. And one of the major tenets of cooperative compliance is educating tenants and landlords so that they can understand the connection between health and housing. Having landlords go through renovation, repair, painting training, teaching them about how to detect moisture in order to address mold issues, talking to the tenants about how they can, the principles of healthy housing, so that they understand the role that they play in terms of keeping a home free of mold. So we do a lot of that. But here comes the hard part. And again, it goes back to the whole politics here in terms of providing funding to do cooperative compliance. I mean, traditionally, we do enforced compliance. We try to hammer the landlord with fines and penalties. Our elected officials are reluctant to charge an annual fee on rental properties to help fund the work we do. And yet we really need to have like a HUD lead hazard control model in which, we use those grants in order to go to the owners and say, you have a problem, but we have some funding sources to help you fix it. The same thing when we sued the paint companies and we just got this big lead paint settlement. That money is to now be used to help the landlords. The American Rescue Plan Act money, we're using that to try to help landlords. It's important, although sometimes they're adversaries, they really are partners in terms of providing housing to people who really need to have a roof over their head. And I know I saw someone in the chat box say something about that wrestling match in terms of, well, do we want to make them fix things if it costs people ending up on the street? And one of the stories we're trying to tell through the media is about those folks who are in those difficult situations. I call them the unseen homeless, because everybody focuses the camera on the tents on the street. They don't go into the houses and see people living in these substandard, uninhabitable conditions who are afraid that they could end up on the street. So until we can tell that story better and get community support for it, it's really difficult to have the tools to be in a cooperative compliance model.
I think that's really important, Larry. Thanks. Kathy, I'm curious, do you have any thoughts on this question as well, in terms of, you probably potentially from representing clients that may, be facing their own challenges as it relates to staying in compliance with, their obligations?
I think it's always a challenge. And if we have a client who themselves is maybe contributing to some of the underlying causes, I think we try to work with that client before going to the landlord about something, given the posture that we're coming in at, which is, as an attorney on the case, I think it tends to raise the adversarial nature of the case usually. But I will say we often find, in almost every case I personally have ever litigated, we'll say, like, there's a mouse infestation, and the answer will always be like, it's your client, regardless of what the underlying issue is. And one challenge of litigating these cases we represent one family, is you can't really solve a whole building mouse problem litigating it unit by unit, right? You really need a whole building solution. And that's the other problem with complaint-based inspection, if you're really only looking at one unit in the building. And again, that's why I'm bringing this back to a slightly different point, but it's, again, really thinking about how you can bring people into compliance thinking about the whole property, because you're really wasting your resources going unit by unit otherwise, because many of the problems that we're all seeing are not a single unit's problem. It's something that needs to be fixed and dealt with in the whole building. And I know a lot of these questions that we're seeing are about funding and how do you do that, but both its unique resources coming in, and I think it can be thinking about how to creatively use fines and fees that you collect to bring them back, right? Like, there's unique ways to do that as well. But in the experience that I've had thus far, there's a lot fewer landlords who can't afford to do some of the repairs than initially say that they can't afford to do the repairs. I've had very few landlords that I've had just say they have the money up front, and virtually all of them, once we get further in the case, are like, oh, I do have the money. Very few people yet. So I'll just leave that there.
I appreciate that. I want to circle then to that question around fines and fees, since it's been coming up a lot in the chat. I think here, at Change Lab, we have our own sort of stake on this, but I'm curious what your experience has been with fines and fees. Kathy, you were mentioning a little bit about the challenge of non-collection, right? That when you bring enforcement actions that are the fine perspective, that there's actually a lot of overhead that has to go into getting that money, right? You have to get a judgment. You have to, follow up on that judgment if they're not complying with it. I mean, there's a big legal process there. And I'm curious, I think with regards to sort of the fees, you talked a little bit about tiered structures. So I'm curious if we could just sort of talk a little bit about, what are the right ways to utilize fines and fees as incentives, and who are they really targeting? They're both sort of tools for compliance, but is it that fees are more about, and if you were to tier like your registration structure, that might be about almost more of a carrot kind of incentive where, we would give people a benefit for prior compliance and reduced fees, or are they money generating things? What's your take on all that?
To start and have others jump in. I think I don't, this is like a back of the envelope number, and I'm curious what Larry and Liz would add to it, but in order to get voluntary compliance, which is I think what we want from the vast majority of property owners, we need to have enough, like we need that from like 95% of people for the system to work, because we just don't have enough enforcement and inspection for to go around, right, in most cities. I think we need a system with enough carrots and sticks to work, right? And so I think we need some fines to illustrate for people who are on the border of, should I do this, should I not? That might help them make the decision not to. And certainly for the really bad ones that we see, which again in DC, we don't know if we have 5 really bad or 500 really bad, or 50 really bad, because we have this LLC problem of we don't know who really owns the buildings, but we need something to hold those people accountable. That's more than a slap on the wrist once we finally get down the path of actually bringing them into court. But I don't necessarily think we want to discourage people from entering the rental market or renting to low-income tenants. So we don't necessarily want rental registration to be a money-generating thing. We want people to enter the market, we want people to get the license and not try to subvert the process. So we don't want to make it so expensive that it's impossible to do that. And we want people to comply with each part of the process. So I think, figuring out the right balance is definitely tricky, and we do want people to be licensed, because in DC that requires them to get inspected and register, and then we know who they are, which I think is an important piece of it.
I'll jump in real quick. We have to think about the goal of code enforcement, which is to bring about compliance. And so, you may have fees to cover your costs of going out and doing an inspection and re-inspection fees. But then you have to have things like fines and penalties for people who do not cooperate with you. And so, there has to be a little bit of a stick to go along with the carrots sometime. But there's other ways to use both a stick and a carrot. And what I'm saying here is in terms of, if the goal is to bring about compliance, there are those tools in the toolbox that some cities and counties have, such as a relocation fund, a rent escrow account program, receiverships. These are ways that you then get the money and you go and make the repairs. I used to have a clean and lean fund, because one time I ran into an apartment where there was no hot water and we had to try to relocate all the families, and it was a disaster. The next time we ran into that, the Board of Supervisors had learned their lesson. We were able to use a clean and lean fund, and we just fixed the boiler. And everybody got their hot water, and we didn't have to relocate anyone. So there's these creative ways that you can do a little mixture of both carrot and stick in order to achieve what the goal is, which is just to put people in safe and healthy housing.
Larry, when you used that kind of money, did you then recoup the cost from the landlord?
Mm-hmm. Yeah, property tax lien.
Yeah, I totally agree with Kathy and Larry about the need for both carrots and sticks. And then the question becomes, what's the balance? And particularly when you're talking about fines and fees, what's an incentive versus what's a detriment in terms of getting people to do what you want them to do. And I would just add as a researcher and an academic that, this is something, as we really try to move the ball down the road with code enforcement, it's important for us to study, to look at different ways of approaching these questions and actually trying to build some data and some evidence around, what's likely to make changes in behavior. And, a lot of that sort of economic research, which is not my expertise, but I think I would just make a plug for the need to actually build an evidence base about that.
Thanks. So we're wrapping up now, but I want to circle back with you all one more time just to figure out where are you all going next in your work in this area? What's next for, the advocacy efforts in DC or for the Healthy Homes Department, or what are you researching next, Liz? Where do we move forward? Where are you moving forward next? And maybe people can glean some insights from that.
Larry, you want to go?
Oh, no, Liz, you go.
Okay. I think from my perspective, I'm really trying to understand these housing issues, and in particular, enforcement and the idea of equitable enforcement in a larger context of health justice, and really trying to understand the ways in which we think about law and the enforcement of law, and the way law is implemented, and the way that law is perceived on the streets by people, to better understand how we can start to, I think, educate the public, educate politicians and policymakers about how important these issues are to health. And I think in terms of housing in particular, we know, and I think Lauren Taylor's piece sort of lays it out very well that you started with, Greg. We know how fundamentally connected housing is to public health and health outcomes. And the question is, how can we really further demonstrate, and I think that's what I'm trying to do with my work, further demonstrate that to decision makers about how resources are prioritized, how incentives are built into systems, really with an equity lens to understand the implications of the ways in which we implement and enforce laws, and the impact that has on different communities, and creating health disparities.
I want to try to answer a question here in the Q&A box here, while at the same time, Greg, trying to talk about what you're pointing out. And it was, could you speak about the real strain responding to smoke complaints, and the strain that it's placing on code enforcement, definitely in terms of not just smoke, but marijuana regulations, massage parlor regulations, face mask enforcement. Our elected officials do a pretty good job at asking us to do things, but not a very good job at funding it for us to do them. And so, like, I'm meeting with a public relations company later today, and we're hoping that they will do some things pro bono for us to help share that story, because I talked about the unseen homeless. I guess I should talk about the unseen code enforcement officer, because we're getting these increasing mandates on our work, and nothing to support it funding wise. I'm meeting with our Oakland Athletics, our professional baseball team, trying to get a conversation with the Warriors, because I would like to try to get some of those folks to focus on the violations we're trying to correct, get them to do some public service announcements, talking about lead and asthma. Because I think the more we get the story out there, the better we're going to be in terms of promoting some type of systems change. Oakland did a race and equity impact analysis, and it's an excellent piece of work. It describes some of the historical impacts of health and housing, as well as gives recommendations as to what needs to be done. And I think we need more of that type of data collection. And then again, we need to be able to get to the people in the media to share the story, because if they share the story, the politicians will follow.
Great. Sorry, Kathy, I'm going to have to cut you off. We're like really running into time. So apologies for that, but maybe we can go back to the slides now, Dylan. I just really want to uplift and appreciate everything that everyone's been adding today. So unfortunately, that's all the time we have today. And I want to thank Larry, Liz, and Kathy again for sharing your insights, and thank you all the attendees for tuning into the discussion, and for the thoughtful questions and the robust discussion and the the chat. Before we close, we'll be posting a link to this recording along with a summary of the conversation and any key resources mentioned on our website at changelabsolutions.org. And as Shaniqua noted earlier, we hope you'll join us for the upcoming sessions in our Equity Action Series, which I think is highlighted on the next slide. Up next, we have an incredible panel lined up to talk about fair labor practices and policies. And we'll be sharing more info in the registration link for that through our email newsletter and on our website and social media very soon. And before you go, we just appreciate it if you took a moment to share your feedback about this session. Zoom will automatically direct you to a brief feedback form when this event ends. So please stay connected. A couple of our resources on proactive rental inspection were thrown up there earlier. And thank you all so much. This was a really great event. And thank you to the panelists as well.